Good afternoon, I'm Zach Meisel from the Department of Emergency Medicine and LDI, and today I'm going to talk to you about the Center for Health Economics Treatment Interventions for Substance Use Disorder, Hepatitis C, and HIV. And if there ever were a center that needed an acronym, this is it, and we got it, and it's called CHERISH. CHERISH is a Center of Excellence, a multi-institutional center of excellence funded by NIDA, National Institute of Drug Abuse. And here at Penn and at LDI, we are the policy and dissemination core for this multi-institutional center. And I'm going to talk to you about what we do. So our overall goals really are to both develop and disseminate evidence in this important area. So the landscape of the health economics of substance use disorder treatment, hepatitis C treatment, and HIV treatment is very complex and very hot right now, and pretty important. As we heard from Secretary Murphy, the opioid prescription drug crisis is a unprecedented public health crisis. We have substance use disorder treatment plans that are costly. We have budget-busting hepatitis C treatment medications that have come online. We have Obamacare, which has created both coverage expansion as well as integrated and accountable care organizations. The need for research in this space to get to key stakeholders is very high. And our goal here at the Dissemination and Policy Core for CHERISH is to actually bring the research to the stakeholders and to learn from stakeholders what the research needs are and to feed it back into the research enterprise so that we are doing not only the best research that can inform policy in this space, but that we are also disseminating the highest quality research. Our process here at the CHERISH Dissemination Policy Core is really informed by a knowledge transfer framework that uses both a push, pull, and exchange algorithm. And our goal is to both take the best health economics research that's being done by center investigators and their affiliates and get it to stakeholders. And by stakeholders, we mean not just governmental policymakers, but executives of health systems, by payers, by health insurance leaders, and by providers as well. And to also to learn from these stakeholders what the research needs are and loop it back around to policy researchers. One of the first activities of our core is to do an in-depth needs assessment, and this needs assessment is really informed by in-depth interviews with key policymakers in this space. And so I ask you as LDI affiliates if you have connections or thoughts to people who are making key decisions in this space and you think would be useful for us in our needs assessment to identify what the key policy needs are in this space so that we can feed it back into the research enterprise, please let us know. We're using a snowball sampling methods to actually expand our interview population and to really do a high quality needs assessment. The second piece of what we're doing here at CHERISH also has direct relevance to LDI, the LDI community, and I want to turn your attention to basically two opportunities up on the slide and one additional one. And the opportunities are a methodology consultation service that is free for anyone who is interested in conducting health economics research or health policy related research in these areas. The consultation service is based out of Cornell, which is the administrative core for this project. And they will provide up to 6 hours of free consultative services that can help at any stage in a research project. There's the form, it's an easy online way to access it, and you can get to it through cherishresearch.org. The second piece are a series of annual pilot grants that are up to $20,000 each. And they're available to anyone who's affiliated with Cherish, which means all of you, because you are connected to us and we are connected to Cherish. So keep your eyes out. Those announcements will go out through LDI.